The hygiene practices of the Middle Ages were anything but normal and acceptable by today's standards. Exploring the peculiar rituals and habits of that era will offer an interesting insight into the past, shedding light on the somewhat repulsive yet captivating ways of staying clean. Number 1. Public bathhouses and communal washing. During the Middle Ages, communal bathhouses were popular social gathering places where people from all social classes would come together to cleanse, relax, and socialize. These establishments provided not only hygiene but also leisure activities, featuring warm baths, steam rooms, and even food and drinks. The bathing process was simple. Individuals would undress, store their belongings, and then proceed to the bathing area where heated water-filled tubs awaited them. Fragrance was often added to the baths with herbs and flowers. Regardless of social status, people would bathe together, enjoying the warmth and steam. In some cultures, bath attendants were available to assist with scrubbing and offering massages. However, these public bathhouses had their drawbacks. The water was not regularly changed, leading to quick contamination and the proliferation of bacteria and disease. Unfortunately, with the emergence of the plague and the growing influence of the church, public bathing became associated with immorality and illness. Consequently, many bathhouses were shut down, and bathing itself became less common, limited to washing visible body parts like hands, face, and neck. Number 2. Bloodletting as a hygiene practice. Bloodletting was a common practice in the Middle Ages that aimed to maintain health and hygiene. The belief was rooted in the theory of humors, which stated that the human body had 4 humors: blood, phlegm, yellow bile, and black bile. A balance among these humors was crucial for good health, and any disruption could result in illness. To restore balance, bloodletting was used, particularly when there was an apparent excess of blood. This process involved making incisions on specific points of the body, sometimes with the help of leeches, to allow the blood to drain out. Barber surgeons, who also tended to hair, performed these procedures using tools such as lancets, scarificators, and flames to puncture the skin and veins. However, bloodletting carried risks. Excessive blood loss could lead to severe weakness, anemia, and even death. Fainting during the process was not uncommon, and there was a constant risk of infection at the incision site. For centuries, bloodletting was widely accepted as an effective practice until the late 19th century, when advances in medical science and the debunking of the theory of humors caused it to lose favor. Bloodletting in the Middle Ages was a mix of medical practice, superstition, and ritual, reflecting the understanding and beliefs about health and hygiene during that time. Today, it serves as a captivating historical illustration of how societies have approached the complex concept of hygiene throughout human history. Number 3. Powdered wigs to cover lice infestation. During the Middle Ages, particularly in the 17th and 18th centuries, one of the most iconic fashion trends was the powdered wig, also known as a peruke. Although we now associate these wigs with fashion and status, their original purpose was more practical than glamorous. They were actually used to combat widespread lice infestations. Personal hygiene was not a priority during this era, and people rarely bathed, leading to frequent lice outbreaks. Apart from causing intense itching and discomfort, lice also posed a health risk as they could transmit diseases. To address this issue, many people resorted to shaving their heads and donning wigs instead. Wigs were easier to treat for lice by removing them from the head and subjecting them to various remedies, such as baking them in an oven or drenching them in a special concoction designed to eradicate the parasites. To maintain a fashionable appearance, the wigs were often powdered with a mixture of starch and fragrances, giving them a stylish white or off-white color that was trendy at the time. Some powders even contained lavender or orange to mask any unpleasant odors. Although we may view this measure as extreme for combating lice, during the Middle Ages, it was seen as a clever solution to a common and bothersome problem. Number 4. Tossing waste out of windows. In the medieval period, waste management techniques differed greatly from our modern ones. In crowded urban areas, it was common to dispose of human waste by simply throwing it out of windows. Due to the lack of indoor plumbing and sewage systems, people had to find a way to get rid of their waste, and the easiest solution was to toss it onto the streets. Containers containing urine and feces, known as chamber pots, were emptied out of windows while a warning shout of "Guardez-l'eau" was made. This phrase derived from the French expression "Regardez-l'eau," which meant to watch out for the water. The intention was to alert pedestrians to the potential danger from above, although this warning was not always effective. Unfortunately, there were instances where unsuspecting individuals would become the recipients of these unpleasant showers. The waste that was disposed of in this manner would collect in the streets, creating an extremely unhygienic and unsanitary environment. Occasionally, rain would wash away the waste, but more often than not, it would remain, resulting in an overwhelmingly foul odor and offering an ideal breeding ground for diseases. Number 5. Groom of the stool. A royal hygiene job. The groom of the stool was a prestigious and unique role within the English royal court during the Middle Ages. The position involved tending to the king's bodily needs and maintaining his personal cleanliness. Although it may appear unpleasant by today's standards, it was a highly desired job due to the close access it granted to the monarch. Named after the portable toilet, the groom of the stool was in charge of aiding the king in the privy. This included providing water for the king's hands before and after meals, assisting with dressing and undressing, and taking care of the royal garments and accessories. Beyond these tasks, the groom of the stool had a significant role as they enjoyed unparalleled personal proximity to the king. Often, the person holding this position became a trusted confidant of the monarch and held significant influence behind the scenes. Due to this, the role was typically given to someone of high birth, further enhancing its prestige. Despite its unappealing nature, the position of the groom of the stool demonstrates how personal hygiene was a communal and social affair even at the highest echelons of society during the Middle Ages. It serves as a reminder of how attitudes towards privacy and hygiene have changed throughout history. Number 6. Animal dung in medical practices. The use of animal dung as a medical treatment was an unexpected element of hygiene in the Middle Ages. Various remedies incorporated this uncommon ingredient, believing it had healing properties. Cow dung was frequently utilized in poultices and salves for treating wounds and burns, as it was thought to draw out toxins and heat. Pigeon dung mixed with oil was believed to alleviate baldness when applied to the scalp. Similarly, dog dung was seen as a remedy for sore throats and tonsillitis when externally applied to the throat, and it was used in ointments for various skin conditions. Although these treatments may appear shocking or repulsive to us, it is important to keep in mind that the understanding of disease and the functioning of the human body was very limited during this time. These remedies were developed through a trial-and-error approach based on observation and correlation, rather than a scientific understanding of biology or pathology. Nevertheless, they remind us of the significant advancements made in medical science and hygiene practices over the centuries. Number 7. The absence of toilet video. During the Middle Ages, bathroom hygiene practices differed greatly from the present. Instead of using toilet paper, people resorted to various alternatives for cleaning themselves after using the bathroom. Water and the left hand were the most common materials used for this purpose. As a result, the right hand was mainly used for greeting and eating. Hay, moss, and leaves were also commonly employed, along with rags, wool, or hemp in wealthier households. To enhance cleanliness, these materials were typically soaked in water or vinegar. For a more comfortable option, a sponge attached to a stick, known as a xylospondium, was used. It would often be soaked in brine or vinegar and shared among users. After each use, it was rinsed in a bucket of salt water or vinegar. In communal toilet setups like monasteries or castles, a communal cloth called a gomph stick might be utilized. This stick had a cloth attached to one end and was placed in a central location accessible to all users. While these practices may seem unsanitary by today's standards, they were considered normal and effective during that era. These methods highlight the adaptability of societies to the resources available to them, and although they may appear strange to us now, they served their purpose during the Middle Ages. Number 8. Using herbs and flowers to mask odors. The Middle Ages wasn't exactly known for its pleasant smells due to the lack of proper sanitation and abundance of open sewers. To combat this issue, people turned to herbs and flowers as a way to cover up the bad odors. Strong-scented herbs like rosemary, thyme, and lavender were popular choices and were scattered on the floors of homes, releasing their fragrance as people walked on them. This practice wasn't only limited to homes. Herbs were also used in public spaces like markets and churches, giving rise to the term strewing herbs. Flowers served a similar purpose, especially among the upper classes who carried bouquets of fragrant flowers to act as medieval air fresheners. These bouquets, known as nosegays or posies, could be held up to the nose to mask the unpleasant smells of the surroundings. Despite their seemingly humble nature, herbs and flowers played a vital role in medieval hygiene practices, showcasing the practical cleverness of people in the past and their knowledge of the plants available to them. Number 9. Fasting for purification. Fasting, the act of refraining from food and sometimes drink, has been a long-standing custom in multiple cultures and religions. In the Middle Ages, it became an important part of Christian practices in Europe, serving as a way to demonstrate devotion and to purify both the physical and spiritual self. Fasting was closely associated with the idea of purifying the body and soul. The Church designated specific days of fasting throughout the year, with Lent being the most significant period, lasting 40 days before Easter. During this time, people were encouraged to abstain from certain foods, particularly meat, dairy products, and eggs. This abstinence served as a test of discipline, devotion, and a means to cleanse the body. Not only did people observe annual fasts, but there were also weekly fasts. Wednesdays and Fridays were typically designated as fasting days to commemorate the betrayal and crucifixion of Jesus. Although the dietary restrictions on these days were usually less strict compared to Lent, they served as regular reminders of faith and the importance of spiritual purity. Promoting internal purity as a part of hygiene was a crucial aspect of life in the Middle Ages. While fasting carried religious undertones, it was also linked to a broader understanding of health and well-being. Medieval medicine emphasized the balance of the body's 4 humors: black bile, yellow bile, phlegm, and blood, and fasting was considered a means to restore this balance after periods of excess. Nevertheless, fasting faced criticism even during that time. Some argued that it weakened the body and made individuals more susceptible to illness. Others believed that fasting was often performed for show rather than genuine religious devotion. Nevertheless, fasting highlighted the interconnectedness of spiritual and physical purity during the Middle Ages. It was viewed as a method for maintaining personal health and moral integrity, reflecting the holistic approach to hygiene that prevailed in that era. While modern hygiene primarily centers around disease prevention through cleanliness, the Middle Ages encompassed a more comprehensive and holistic approach, encompassing spiritual and moral purity. Fasting perfectly exemplifies this. Despite being perceived differently in our current understanding of hygiene, fasting epitomized the multifaceted approach to cleanliness during the Middle Ages, which acknowledged not only the body, but also the soul. Number 10. The plague doctor's outfit. The attire worn by plague doctors in the Middle Ages remains one of the most eerie and well-known symbols of that time period, particularly in regards to hygiene and disease. This distinctive ensemble served as a form of defense for the doctors who dared to treat patients during the outbreak of the bubonic plague, also known as the Black Death. Covering the entire body, the outfit consisted of a coated overcoat, leather gloves, boots, and a broad-brimmed hat. The most notable aspect, however, was the bird-like mask, which was created to contain aromatic substances and straw believed to cleanse the air the doctor breathed, guarding against the miasma or foul air believed to be responsible for the spread of the disease. The beak-shaped mask was filled with various substances like cloves, myrrh, rose petals, or camphor, thought to repel the plague. The mask's eyes were shielded by glass, and the entire ensemble was completed with a wide-brimmed hat symbolizing the wearer's profession in the field of medicine. Despite its unsettling appearance, the plague doctor's outfit represents an early form of personal protective equipment. Although their understanding of disease transmission was flawed, the outfit may have offered some level of protection simply by physically separating the doctors from their patients. Number 11. Lack of dental care and toothpaste substitutes. During the Middle Ages, dental care lacked the sophistication of modern standards. Trained dentists were non-existent, and oral health knowledge was basic at best. In such cases, barber surgeons were relied upon for more serious oral health issues such as tooth extraction. However, even without formal care, people still made efforts to maintain oral hygiene. The main method of teeth cleaning involved using a cloth, water, and occasionally salt. In the absence of toothbrushes, the cloth was rubbed against the teeth to eliminate food particles and plaque. Some individuals also resorted to chewing on sticks or twigs with frayed ends to clean their teeth, which was a primitive form of a toothbrush. An unconventional substitute for toothpaste was the use of ashes. These ashes, derived from burnt herbs, burnt bread, and even burnt mouse heads, were believed to possess abrasive properties capable of eliminating grime and plaque buildup. Moreover, toothpaste powders made from the bones of specific animals were utilized. It should be noted that despite the rudimentary nature of these substances, their abrasive quality might have contributed to their effectiveness in removing dental plaque. Number 12. Miasma theory. Bad air causes disease. During the Middle Ages, there was a widespread belief known as the miasma theory, which suggested that diseases like the plague, cholera, and chlamydia were caused by unpleasant-smelling air or miasma. According to this concept, diseases were carried by the foul odors associated with decaying organic matter and poor sanitation. This belief influenced various aspects of medieval life, including hygiene practices. It led people to believe that strong smells could prevent disease, resulting in the use of aromatic herbs and flowers in homes and public spaces. The theory also influenced the design of the plague doctor's outfit, which included a beak-like mask filled with aromatic substances to purify the air they breathed. Likewise, this theory affected people's avoidance of bathhouses during plague outbreaks, as it was believed that the hot and humid air in these places produced miasmas. The miasma theory prevailed until the 19th century, when the germ theory of disease emerged, establishing that specific microorganisms are responsible for causing diseases. Despite its flaws, the miasma theory represented a significant attempt to scientifically comprehend and explain the origins of diseases in a time before the discovery of bacteria and viruses. Number 13. Hygiene during childbirth. Maternal and infant mortality rates were alarmingly high during the Middle Ages, largely due to a lack of understanding about hygiene during childbirth. There were no sterilization practices, and midwives frequently delivered babies without washing their hands first. The birthing room itself was unsanitary by modern standards, often containing animals and multiple people. Despite these challenges, there were some efforts to maintain cleanliness during childbirth. Women in labor would commonly be given a bath, although this was primarily for comfort rather than hygiene. Garlic was often used in birthing chambers for its believed protective qualities against evil spirits and infections. Likewise, the umbilical cord would be tied off with specially prepared threads, like those soaked in oil or fat, as a primitive form of antisepsis. Although these practices may appear rudimentary or ineffective to us, they did reflect an early awareness of the importance of cleanliness in preventing disease and infection. Number 14. Unusual beauty routines as hygiene practices in the Middle Ages. The Middle Ages had a close association between perceptions of beauty and hygiene. However, what was considered necessary for maintaining good hygiene in those times might be seen as strange or harmful today. These practices offer valuable insights into cleanliness and beauty standards of that era. Lead-based cosmetics, for example, were popular among women in their beauty regimens. Having pale skin was highly prized as a symbol of beauty, purity, and wealth, indicating a life untouched by outdoor labor. To achieve this fashionable pale complexion, women applied a mixture called Venetian ceruse, made from white lead and vinegar, to their faces. Queen Elizabeth I of England was a notable user of this cosmetic, and her preference for it gave rise to the term the Elizabethan look. Another unusual practice was the use of scented bags called pomanders. These small bags, worn around the neck or waist, contained aromatic herbs and spices like cloves, lavender, or nutmeg. They were used to mask unpleasant body odors since regular bathing was not common during that period. The scent of the pomander was also believed to purify the air and provide protection against diseases. Hair removal was prevalent, not just on the head. Medieval beauty standards dictated that a high forehead was desirable, leading many women to pluck or shave their hairlines to create the illusion of a broader forehead. Shaping eyebrows into thin, arched shapes was also common and seen as the epitome of beauty. Oral hygiene was an important aspect of beauty routines as well. While dental care was basic compared to today, people did have methods to clean their teeth and freshen their breath. They used sage leaves for rubbing on their teeth and gums for their cleansing properties. Thin twigs with frayed ends, known as chew sticks, were also utilized akin to toothbrushes today. Despite the peculiar and sometimes harmful nature of these practices, they demonstrate an understanding of the significance of personal cleanliness and its social implications. Both beauty and hygiene were considered vital for societal acceptance and personal well-being, highlighting a holistic approach to hygiene that encompassed physical cleanliness and aesthetic appearance. These practices may have changed over time, but the underlying principles, personal care and cleanliness, continue to be relevant to this day. In conclusion, these unconventional beauty routines from the Middle Ages emphasize the ongoing and universal human quest for beauty. Number 15. Using urine for laundry. During the Middle Ages, it was common to use urine for laundry due to its ammonia content. Urine was sought after as a bleaching and washing agent because the alkaline properties of ammonia effectively removed stains and dirt from fabrics. Families would collect urine in pots, let it sit until it reached the right strength, and then mix it with water to create a solution in which clothes were soaked, scrubbed, and wrung out. Public urine collection areas were available in many towns and cities for communal laundry efforts, and cloth manufacturers used urine to soften and clean woolen fabrics before dyeing them. The ammonia in urine also improved the color quality of the cloth by setting certain dyes. Despite the disgust and lack of hygiene by today's standards, using urine for laundry was a practical solution during the Middle Ages, as it was easily accessible and effectively kept clothes clean. This, however, highlights the significant difference in hygiene standards between that time and the modern world.